Greetings. Today, I'll be discussing the vicious cycle of mitochondrial damage and why it matters for your overall health. The primary source of oxidative stress in cells is the leakage of oxygen, reactive oxygen species, and high-energy electrons from the mitochondria during dysfunctional ATP production. This leakage is a strong predictor of longevity across species. The better a species protects its mitochondria, the longer it lives. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, ARTC.Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please note that I'm an avatar of a doctor, and none of the information I convey should be considered medical advice. It is intended for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 9418-065-511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. Leakage. In healthy mitochondria, 1 to 2% of oxygen is lost during energy production. This percentage increases significantly with age, nutrient deficiencies, or toxin exposure. Oxidative stress. The leaked oxygen and electrons form reactive oxygen species, ROS, or free radicals, which act like rust, damaging mtDNA, proteins, and lipids. Inflammation, cellular damage triggers an inflammatory response. Apoptosis, this cycle can lead to programmed cell death, apoptosis, of healthy cells while allowing damaged cells to proliferate. This cycle is exacerbated by numerous factors that increase mitochondrial damage. Oxidants leaked during ATP production. Aging, accumulated oxidative damage to mtDNA. Genomic susceptibility, e.g. APOE4. Toxic metals and persistent organic pollutants, POPs, alcohol. Many common prescription drugs. A number of prescription medications have been identified as particularly damaging to mitochondria. Acetaminophen, antibiotics, e.g. ciprofloxacin can reduce ATP production by 90%. Aspirin, AZT, L-DOPA, NSAIDs, e.g. indomethacin. Statins, known to deplete CoQ10, a key electron transporter. Methamphetamine. Mitochondrial dysfunction is not a niche issue. It is presented as the major contributor to the severity and progression of virtually every chronic condition by creating energy deficits and increasing toxic buildup from oxidative stress. Common symptoms: persistent exhaustion and fatigue, especially afternoon crashes, brain fog and cognitive difficulties, stalled weight loss despite diet and exercise, muscle weakness and poor exercise tolerance, feeling constantly cold, diabetes and metabolic disorders. Dysfunction impairs the ability of muscle and fat cells to use glucose and fats, leading to insulin resistance, poor blood sugar control, and obesity. Heart disease. The energy-demanding heart muscle weakens without sufficient ATP, contributing to heart failure and arrhythmias. Free radicals also damage blood vessels. Neurodegenerative conditions. Brain cells are extremely energy dependent. Dysfunction is linked to Alzheimer's, Parkinson's, and ALS, as reduced energy impairs the clearance of toxic proteins and damages neurons. Cancer. Mitochondria regulate cell growth and death. Dysfunction can allow damaged cells to grow uncontrollably. Research by Dr. Otto Warburg, a 1931 Nobel laureate, proposed that mitochondrial dysfunction is the primary cause of cancer, chronic fatigue, and autoimmune conditions. The core of these conditions is often an inability of mitochondria to produce enough energy for normal function. The proposed strategy to reverse this energy crisis involves first building a solid foundation of health practices, followed by layering on specific optimization therapies under professional guidance. It is emphasized that using advanced tools without a foundation is ineffective. Part 1. The Foundational Protocol, Self-Implementation. These 6 pillars are the non-negotiable groundwork for restoring baseline metabolic and mitochondrial health. 1. appropriate exercise. 2. Sleep optimization. 3. A positive mental outlook and effective stress management. 4. A healthy, nutrient-dense diet rich in protein, vitamins, minerals, and phytonutrients. 5. Living in harmony with your environment. 6. Sound body structure. Optimizing mitochondrial health begins with key lifestyle pillars that support cellular energy production. Appropriate exercise, particularly resistance training 3 times per week for 45 minutes, activates the PGC1 alpha switch responsible for generating new mitochondria while building metabolically active muscle. Sleep optimization is equally foundational, serving as the master hormone regulator for mitochondrial repair. Consistent, high-quality sleep, 7 to 9 hours in a cool room with morning sunlight and evening darkness, helps restore the body's metabolic balance. A positive mental attitude and effective stress management further support mitochondrial resilience, as the way we perceive the world shapes our physiological responses. Cultivating optimism and using any preferred method of stress reduction helps shift the mind toward a healthier, more adaptive state. Nutrition and environmental factors play an equally important role. A nutrient-rich diet paired with thoughtful supplementation is essential for optimal health and performance, especially considering the widespread impact of the standard American diet, SAD. Environmental harmony is also crucial, as the modern world is filled with toxic exposures and unhealthy habits that subtly but continually strain mitochondrial function. Maintaining sound body structure, ensuring that organs, glands, bones, muscles, and connective tissues are functioning properly is fundamental, since structure directly influences overall physiological performance. Additional supportive interventions further enhance mitochondrial repair and efficiency. Strategic fasting activates autophagy, allowing the body to clear out damaged mitochondria. Weekly therapeutic fasts combined with maintenance calorie feasting windows can be highly beneficial. Cold exposure through showers or plunges 2 to 3 times per week, and heat exposure via saunas 3 to 4 times weekly provide hormetic stress that stimulates mitochondrial growth and repair. A targeted supplement stack supports ATP production and protects mitochondria from damage, while a low-inflammatory diet reduces systemic inflammation and improves insulin signaling by emphasizing nutrient-dense foods, healthy fats, and protein, while minimizing processed foods and excess carbohydrates. Quality protein to supplement food intake as needed. My top recommendation is Peak Performance Protein, a product that I developed. It can be found on my bodysymphony.com magnesium and B vitamins, because virtually everyone is deficient to some degree. My top magnesium recommendations are 2 other products I developed. Mag 10X is a blend of 10 different forms of magnesium as a powder that is added to a beverage, allowing maximum absorption. The other is called Mito Energy, which contains everything in Mag 10X plus a very comprehensive B vitamin complex. Both are available on mybodysymphony.com. Magnesium and B complex are involved in multiple energy-producing steps in the mitochondria. Vitamin C is crucial to many functions. Think of it as the body's stress response hormone. I developed a liposomal version that works great. Zinc, copper, and selenium are necessary micronutrients that are involved in hundreds of metabolic enzymatic reactions. Most are deficient. Vit D3 and K2 have multiple benefits, and most are deficient, which will interfere with mitochondrial energy production. There are several additional foundation nutritional supplements, but I won't go into them here. Next, we move on to other specific substances that enhance mitochondrial function. NAD+ or precursors supports NAD+ levels, a critical molecule for energy production, 200 to 500 milligrams per day. NAD+ is very poorly absorbed orally, which is why precursors were developed. Precursors have gotten a lot of marketing hype, but in my opinion, oral liposome delivery of NAD+ is the way to go. Yes, I also developed such a product. Coenzyme Q10 is a vital electron transporter in the electron transport chain. There's a liposomal version of that as well. PQQ supports mitochondrial biogenesis. Creatine supports cellular energy recycling. 5 to 10 plus milligrams per day. Alpha-lipoic acid, a powerful antioxidant that supports the citric acid cycle. These therapies are described as powerful tools to amplify the results of a solid foundation, but should only be used under the care of a qualified medical professional. Several therapeutic options are available to enhance mitochondrial function, improve energy production, and support cellular repair. MoTSC is often referred to as exercise in a bottle because it activates PGC1-alpha, the key driver of mitochondrial biogenesis. It works synergistically with physical activity, leading to exponentially better results, and many individuals notice improved energy within weeks. SS31 is another powerful intervention that stabilizes mitochondrial membranes to prevent electron leakage and reduce inflammation. Originally FDA approved for Barth syndrome, it has demonstrated improved physical performance in clinical trials, and users frequently report reduced brain fog and more stable energy levels. NAD plus therapy functions as a battery charger for mitochondria by replenishing NAD plus levels that naturally decline with age, stress, and restrictive dieting. It can be delivered through IV, liposomal oral formulations, or subcutaneous injections, which are often used for several weeks but should be cycled. Many patients notice a rapid improvement in mental clarity within days. Low-dose naltrexone, LDN, also plays a valuable role by modulating the immune system to reduce chronic inflammation. Although it typically takes 4 to 8 weeks to see effects, notable case studies have documented benefits such as significant weight loss driven solely by the reduction of inflammatory burden. Additional peptide therapies further support systemic healing and inflammation control. BPC-157 and TB-500, often nicknamed the Wolverine peptides, are known for their ability to dramatically boost tissue repair and regenerative capacity throughout the body. For individuals dealing with high levels of uncontrolled inflammation, KPV can be added as a targeted anti-inflammatory peptide to help address one of the primary drivers of metabolic dysfunction. Together, these interventions can significantly enhance mitochondrial health, energy production, and overall physiological performance when used appropriately. Direct clinical measurement of mitochondrial ATP production is not yet commercially available. However, several indirect assessment methods exist. Clinical assessment, identifying an individual's energy drain pattern, e.g., afternoon crashes versus morning fatigue, helps pinpoint the primary system failure. Indirect lab tests, blood levels of lactate and pyruvate can indicate severe dysfunction where anaerobic metabolism is compensating. Urinary organic acid analysis can be useful for identifying specific enzyme dysfunctions within the citric acid cycle. 8-hydroxy-2'-deoxyguanosine, 8-OHDG, a urinary marker that estimates the degree of mtDNA damage from oxidative stress. This test is also noted to be a predictor of cancer risk. Self-administration of advanced optimization protocols is strongly discouraged. Professional guidance is essential for complexity, stacking, timing, and dosing of peptides and other therapies are highly complex and must be tailored to an individual's specific biochemistry and root cause of dysfunction. Pattern recognition. An experienced clinician is needed to accurately diagnose whether the primary issue is mitochondrial depletion, hormonal collapse, or inflammation. Customization. The right therapeutic stack for one pattern of dysfunction is different from another. Monitoring. Success requires tracking specific lab biomarkers and adjusting protocols based on patient response to ensure safety and efficacy. Safety and legality. Many of these powerful compounds, e.g. MOTSC-NAD plus injections, are used off-label for metabolic optimization, making medical supervision crucial. Point. That's exactly why we created the coaching program at Age Reversal Technology Center. You get lab review, a custom protocol built only for your goal and blood work, pharmaceutical-grade peptides that are third-party tested, and weekly check-ins with a clinician who lives and breathes this stuff. If you're ready to stop guessing and actually get the results you've been reading about, call or text us right now at 941-806-5511. Your first 10-minute phone consult is completely free, no pressure, no sales pitch. We'll just tell you straight whether peptides can help you and exactly which ones make sense. Age Reversal Technology Center, 9418-065511-6968. Professional Parkway, Lakewood Ranch, Florida. Nationwide telehealth available. One phone call can change the next 10 years of your life. Make it today.